Hello, welcome to the Stella Life Innovator series. Today, I have the pleasure of talking to Dr. Dilip Dudhat. Dr. Dudhat is a graduate of the Maurice H. Kornberg School of Dentistry at Temple University. Dudhat Dental Group includes 30 practices in the Philadelphia area, providing a wide range of services, including general and cosmetic dentistry, implants, periodontal therapy, including LANAP, treatment of sleep apnea, sports-related medicine, and much more. Dr. Dudhat is also the official dentist of the Philadelphia Eagles. Welcome, Dr. Dudhat.
Thank you.
So happy to have you here. So
Thank
I want
you.
to just ask you some questions about you and your practice and what you do. So what is your practice philosophy that sets you apart from other doctors?
Yeah, my practice philosophy is to not to micromanage. Okay, keep my team very happy. Okay, give them what they need. Okay, and provide the best patient experience. So the most important part that sets us apart is by providing the best patient experience day in, day out. Okay, and by focusing on oral systemic link, okay, pain management solution, and providing the best technologies for my team so they can provide the best experience to my patients.
Yeah, that's awesome. As a hygienist of over 40 years, and I've also been an in-office trainer for 30, keeping that team happy is wonderful because the people will stay with you and the patients have a better experience when everybody has got that harmony together. So yeah, that's really a key to success, I believe. So I'm so happy you're doing that. So as the official dentist of the Philadelphia Eagles, you provide care for the players, the coaches, and their front office staff as well. And you get to be there at every Eagles home game. So it sounds like a lot of fun, but I'm sure there are challenges there.
Yeah, there are challenges in terms of meeting the expectations of Eagles organization, right? They have such expectation, and I was able to qualify for such expectation, delivering those expectations by having technologies, having few locations, okay, and providing comprehensive care to their players, okay, and being available when I'm needed. So them seeing my reviews, my experience and my practices with the technologies, they're able to offer me a position, and I didn't resist.
It's a great offer. So clearly you're a football fan. I think you also enjoy other sports as well. So it's got to be a lot of fun to be there. Can you share any experiences where you've saved the day for the Eagles?
Yes, I did save days for a couple of players. Beside them coming to my clinics for their routine care, and also providing pre-season screening where we screen every player and we identify who needs to be taken care of. So this way they don't have the same day or field day emergency. So we are very, very thorough in making sure they're all taken care of. But dental emergencies do happen, such as ortho wire coming off from the bracket. Okay, or patient having trouble after the treatment was completed, and then maybe they're having some sensitivity. So on the field, we pretty much provide the emergency that will be manageable for player to go back to field, okay, and perform their duties. Okay, so like I said, ortho wire came off, we just put the ortho wire back in. Okay, if patient having sensitivity after the work was done, then let's evaluate it just so they can come back and make the arrangement to to take care of their dental problem before it becomes emergency where they have to call out. Right. So good news is that no player no player called out during the last season because we took care of them before this happened.
That is perfect. And then I know you had some players who've had issues with their breathing due to sleep apnea. And from what I understand, you're able to enhance their performance. So tell us a bit about that.
Yeah, so since we have the technology of CBCT, we're able to see the airway openings in patient, in a big size patients, or the patients who have a history of heart problems or obese, right? So then once we had identified that airway openings or the size of the opening that they have. We offer them such treatment for them to be able to sleep well at night, right? So when they sleep well at night, they're rested, they're able to perform their duties properly. Okay, so we identify based on their body type, okay, based on clinical signs that we see. But having that technology and having 5 questionnaires page where they answer the questions if they qualify for such treatment or not. And of course, we do ask for sleep test as well, just to make sure that we're covering medical side of it. So having technology and having knowledge, okay, and having the support from the lab, we're able to provide the treatment that they can wear during the nighttime and sleep well.
Well, that's definitely going to help them have much better gains and their training and everything else, not to mention a better life and the longer life, because
Exactly.
without oxygen, you're in trouble. So I think that's really a key factor that all of us in the dental profession really need to be looking at as number one. So that's pretty amazing. So do you have any advice for doctors that are treating athletes, whether they're pros or young athletes, and how to incorporate this into their practices?
Yeah, the advice will be to listen to them first, okay, to see what their concerns are, okay, and then if they don't have any questions, concerns, right, and then you educate them on what you find, because a lot of players, sports players, have a habit of drinking soda, Gatorade, right? So they have to make sure that they're well educated, because acidity will play a huge role in causing cavities and having to go through root canals and extraction, blah, blah, blah. So it's very important that we educate them on how this certain type of diets play a role in causing acidic erosion.
Yeah, absolutely. And that's something too, that as we go through our day, we have our schedule, we're in a hurry, but with a well-trained and happy team, as you have,
Right.
we have the hygienists and the assistants and everybody supporting that education. So that sounds great. So,
and then another advice I would give you is that because they're players, you have to make sure that they don't have existing dental problems. If they do, take care of them just so they can perform their duties. Okay, so being on top of them, educating them, using the intraoral scanner, using the CBCT, let them see it. When they see it, they'll believe it, right? And then ask them why they don't want to get started with what needs to be done. So, but we want to make sure we fix that why.
That's really huge, because I know that having worked with so many offices and helping to assist them with best communication, that is one piece that's often left out, is asking the patient, what is keeping you from moving forward? Is there anything I haven't been clear about? Those kinds of questions, and asking for their feedback rather than just doing a case presentation, hoping for the best, and then saying goodbye. So yeah, that's critically important, and you're really then helping that patient. So yeah.
And I leave the door open. You can go to another doctor, Dr. A, B, C, D. This is the treatment that you need. Okay, you don't have to get it done from my office. Be my guest. Okay, but so when you leave the door open and let them, if they have trust with you or trust in you, they will continue care with you.
Absolutely, it is all about that trust and that relationship.
Thank you.
So, great. Well, thank you so much for sharing your experience and what you're doing in your practice. I was very happy and excited to meet you, and go Eagles.
That's right. Go Eagles. Thank you for giving me the opportunity to give you my, perspectives.
Thank you so much, Doctor.
Have a wonderful day.
Thank you. And thank you, everybody, for joining us today on our Stella Life Innovators series. Please come back. So we're going to be talking to many amazing doctors and others like Dr. Dudhat. So join us next time. And until then, stay well and stay safe and stay happy.
Thank you.
Thank you.